Well, it's sad to say that the new celebrity hotspot seems to be rehab. Actor David Duchovny has checked himself into rehab for his addiction.
He says that he is addicted to sex, thinks about it all the time, can't get enough of it, and he needs treatment. But is this a real illness or just an excuse for bad behavior?
Well, we can't answer that, which is why we brought in the expert, Dr. Carol Clark, a sex addiction expert. Thank you so much for joining us this morning. I was reading up on this. It says that biochemical abnormality and or brain changes can cause sexual addictions. And I'm thinking, okay, brain changes. I think we change like every 7 years as human beings. Are these like non-learned changes?
Yes, once a person switches behavior into an addictive place, then there are permanent changes to the brain because the brain adapts to the heightened levels of dopamine that are released and all the other feel-good chemicals that our brains have, and it tries to readapt, and that causes the tolerance that we develop with any kind of addiction, needing more to get the same effect. So basically we're raising our baselines of what it takes to feel good, and we need more and more and more.
I was watching a Discovery Channel documentary on this topic, and it likened it, like you said, sex addiction to drug addiction, and it also made the point that, you know, it's not so much about sex, it's about the thrill of seeking the sex.
Absolutely. It's about stimulation. Our brains become addicted to stimulation. So whether that stimulation comes from cocaine or food or gambling or sex, it's all the same thing to the brain. It just makes that connection that, oh, I can get my fix from this particular activity.
Now, does self-esteem have anything to do with this?
Yes. A lot of researchers say that this begins with basic impaired thinking, that we have a feeling of worthlessness and I'm not lovable. And so we crave certain activities to make ourselves feel better, to compensate.
Yeah. Well, you know what? I can see a lot of skeptics at home saying, yeah, somebody got caught, and now they're saying, I'm an addict. How often is this really addiction? How often is it just an excuse for bad behavior?
You know, the short definition of addiction is obsessive, compulsive, out-of-control behavior done in spite of negative consequences to self and others. So I always say to people, if you can fit it into that model, then it's addiction.
You've come up with actually a quiz that you can take, and you can determine whether someone is a sex addict.
Right. I base that on the diagnostic criteria for substance dependence. And when you substitute a sexual behavior or activity instead of doing a substance, it works.
In other words, if you're trying to quit but you can't, that's one sign.
Trying to quit and you can't, needing more and more and more. When you try to quit and you start to suffer withdrawal symptoms such as depression and anxiety, and when it negatively impacts major life areas.
And is rehab really just the be-all of getting this under control?
Rehab is just part of it. It starts with the desire, the recognition, this is a problem, I need to stop. And then you need to bring in every tool at your disposal, all the ammunition, and that includes rehab, outpatient therapy, meetings. The anonymous 12-step meetings are a real important part of recovery.
Real quick, are men more prone to this than women?
Men are. We have a lot of women, but mostly men, because our society accepts men doing a lot of sexual activities.
Yeah. And the flip side also, if you're with someone who is a quote-unquote sex addict, then how does that impact you, and what do you do?
Oh, it's really hard for partners because they take it so personally, and I really urge partners to believe that when their partner is acting out sexually with someone else, that someone else is an object. It's not a person, so it's not about comparing yourself to whoever your partner's acting out with.
One last thing, we've got 10 seconds here. Sex addicts, do they tend to come from abused home? Maybe they were abused as a child?
They may be, but not always. And there's different types of abuse, so it's not necessarily sexual or physical abuse. There's some kind of emotional abuse or neglect going on.
All right, real quick, if someone needs help, where can they go here in South Florida?
They can go to any of the 12-step meetings, SLAA, or they could call me.
All righty.
And we'll have that on our Jim and Jade webpage. So we thank you very much, Dr. Clark.
All right, thank you,
Appreciate
Dr.
your
Clark.
visit.